This is Real News Media TV, coverage you can trust. Please like, share, subscribe, and hit the notification bell. Select all for daily news updates. COVID-19 Vaccination Task Force calls for measures to limit impact of possible fourth wave. The National COVID-19 Vaccination Operationalization Task Force says the government should move to implement enhanced measures to reduce the impact of a possible fourth wave of the virus in Jamaica. The task force is asserting that, given the very low vaccination rate in the population, Jamaica is at high risk of experiencing a fourth wave of COVID-19 infections early in the new year. As of December 3, over 1.1 million doses of vaccines have been administered. Approximately 517,000 persons have been fully vaccinated, and 677,000 persons have received at least one dose, the task force stated. It highlighted that several countries are experiencing a fourth wave of infections, which is leading to an upsurge in the level of hospitalizations, and denoted the threat of the new Omicron variant. The task force said it recently met with Prime Minister Andrew Holness and the Minister of Health and Wellness Dr. Christopher Tufton, and made a number of recommendations for consideration, mainly directed at anticipating the fourth wave and taking steps to prevent hospitals from being overwhelmed. The main recommendations are as follows: reinforce public messaging regarding importance of vaccination and adherence to infection prevention protocols, particularly in the context of a high risk of a fourth wave. Messaging should be easily understood by all groups of Jamaicans and should be delivered by trusted and credible voices. Misinformation, which often drowns out the scientific viewpoint, must be targeted and debunked. The message is every eligible Jamaican should choose to be vaccinated. Specifically focus on the most vulnerable population, that is over 60, as well as the immunocompromised. Efforts must be redoubled to promote vaccination, particularly among the most vulnerable, including the elderly, the immunocompromised, and the persons with comorbidities. Implement vaccination booster doses to all eligible citizens. Commence with those brands that have already been approved by relevant authorities and which are available in large numbers, including J&J. Pfizer boosters should be introduced once the availability of this vaccine is sufficient and the children 12 to 18 are fully vaccinated. Allow for AstraZeneca boosters as soon as approved by the relevant authorities. Focus on enhancing the current home care program for infected persons. The Ministry of Health and Wellness should expand and formalize its home care program to enable persons who do not require hospitalization to recover at home. The provision of home care medical packages should, with appropriate instructions for self-care, be considered. The process of responding to queries for infected persons and their families via hotlines should be expanded. Consideration should also be given to the implementation of a formal telemedicine program supplemented by private doctors to monitor the clinical progress of patients and to arrange for hospital transfers if necessary. We emphasize that proper monitoring of persons under the home care program is critical to ensure timely intervention, including hospitalization if required. Increase availability of testing, including self-testing. The high cost and the limited availability of testing currently serve as deterrents to widespread and frequent testing. The licensing, importation, and the widespread distribution of home testing kits should be expedited. In addition, the certification of an increased number of testing centers should be accelerated. The Ministry of Health and Wellness has already announced support for both. We encourage a close coordination between the private sector and the ministry to get them implemented in the shortest possible time. The goal is to reduce the cost and improve the ease of testing. Early diagnosis is key to limiting spread and also to the success of the home care program. Acquire the new antiviral drugs as soon as possible. This will allow for the treatment of persons immediately upon being diagnosed as being infected. This will reduce the rate of hospitalization and death. Introduce vaccination or test programs in customer-facing public entities and in key economic sectors. Legal advice suggests that the courts are likely to hold that carefully designed policies to protect public health are demonstrably justified in a free and a democratic society and are therefore enforceable. The advice also indicated that once policies are properly designed and the correct procedural steps are taken to implement the policies, it is very unlikely that a judicial review challenge would succeed or that it would prevent the implementation of the policies. The government should ensure that the details of the policies are reasonable and give due consideration to the varying circumstances that may apply to different persons, including carefully designed consequences for failing to be vaccinated and exemptions for those unable to be vaccinated for medical reasons. In designing the policies, the government should consider the terms of similar policies that have been implemented in other jurisdictions with similar legal and constitutional systems. The task force said that proactivity is critical to the restoration of the full productivity of Jamaica's economy and the preservation of the lives of citizens. Chief Justice cites benefits from digital evidence training video. Chief Justice Brian Sykes has welcomed the launch of 3 training videos to guide the collection, use, and understanding of evidence in investigations by declaring that the initiative will aid in creating greater transparency and accountability in the police force. He was speaking at Friday's launch of the training videos entitled Digital Footprints from Crime Scene to Courtroom at the Office of the Commissioner of Police in St. Andrew. The videos were prepared by the Cybercrimes and the Digital Forensic Unit in the Office of the Director of Public Prosecutions in collaboration with support from the United States Embassy and the Jamaica Constabulary Force. The production explores best practices relative to the collection of digital evidence during the process of investigations. According to Sykes, the videos represent an established set of standards by which investigations are to be handled, because what it does is that it is seeking to establish in a very public way standards by which investigations of a particular type, and hopefully it will extend to investigations generally, will be conducted, declared Sykes. What that does is that it demonstrates that you are willing to be held accountable, because once you let it be known how you will do what you are doing, then it means that the public will have greater confidence in the product that comes out of that process, because they already know what your standards are, what is expected, and how you measure up to those standards, the Chief Justice added. To that end, Sykes said suspects, defendants, and other members of the public can begin to have increasing confidence in the administration of justice. For her part, Director of Public Prosecutions Paula Llewellyn said the collection, analysis, and the presentation of digital evidence is critical in ensuring the integrity, cogency, reliability, and admissibility of the evidence that is presented in court. She assured that the videos will serve the legal profession in gaining knowledge of the various concepts and terminologies used by experts in the analysis of data. Several law enforcement agencies are to benefit from the training videos. Among them are the Financial Investigations Division, the Major Organized Crime and Anti-Corruption Agency, and the Integrity Commission. The videos are also to be shared with defense attorneys. Cabinet approves several major contracts. The Cabinet recently approved several major contracts to 3 companies to undertake various works for the government. Among the services to be undertaken are renovation works at the Jamaica Conference Center on Port Royal Street in downtown Kingston, which are to begin shortly. The Cabinet approved the awarding of a $115.08 million contract to JICA Consultants and Construction Limited to undertake the works at the Conference Center. This was disclosed by Minister of Education, Youth and Information Favour Williams at a virtual post-Cabinet press briefing on Wednesday. She further informed that Cabinet also approved the awarding of a $187.17 million contract for the provision of material and labor to Rogers Land Development Limited for the construction of the parking area at the Cornwall Regional Hospital quadrants. That arrangement, said the minister, is to be placed for a period of 8 months. Further, Cabinet also authorized the awarding of a $213.32 million contract to Mothers Enterprise Limited for the provision of canteen concessionaire services for Petrojam Limited for a period of 2 years. 48 new COVID cases in Jamaica, 3 more deaths reported. The Ministry of Health and Wellness reported 48 new COVID-19 cases and 3 deaths on Saturday, December 4, bringing the infection total to 91,469 and total deaths to 2,410. The new cases comprised 27 females and 21 males with ages ranging from 3 months to 95 years. The cases were recorded in St. Catherine 15, Kingston and St. Andrew 8, St. James 7, St. Mary 4, Clarendon 3, St. Anne 3, Westmoreland 3, Hanover 2, Manchester 1, St. Elizabeth 1, and St. Thomas 1. The deaths include an 89-year-old female from Kingston and St. Andrew, a 54-year-old male from St. Mary, whose death was previously under investigation, and a 75-year-old female from St. Catherine. The deaths occurred between December 1 and December 3, 2021. In the meantime, 118 more people recovered in the last 24 hours, bringing total recoveries to 62,942. Currently, 136 people are hospitalized, 17 of which are severely ill, while 10 are critically ill and 20 are moderately ill. Don't forget to like, share, subscribe, and hit the notification bell. Select all for daily news updates.